Hi, everyone. Welcome. My name is Tash. I'm the interim executive director of Restore Oakland, and we're a member of the Care First Community Coalition. And we're really excited to celebrate our recent win and share our learnings and our stories with you today. There's a lot of work ahead to build out a continuum of care in Alameda County that serves everyone. Especially folks who cycle in and out of incarceration. And so we're really psyched to connect with you and to meet with you today. We also have a number of folks from our community, from our coalition here. So this is also a really just nice celebratory, affirming event. With that, I do want to let you know that this webinar is recorded so that we can share it with folks who may not have been able to make it today since it's a Thursday at 11 a.m. So yeah, thank you so much for coming. And with that, I'll just start with a land acknowledgement. And so, yeah, I just want to acknowledge that we're fighting for freedom and decarceration on land that is stolen from Indigenous peoples, specifically the Ohlone people. This land was and continues to be deeply important to the Ohlone, and we stand with them in struggle for recognition, for respect, and for rematriation of the land. And it is from Indigenous communities that we learn that all life is sacred. And they offer us a means to begin the healing process for ourselves and for our communities. And so in that spirit of working to be in right relationship with each other and recognizing that we are on their land is to reckon the impact of racism and colonization on Black and Brown lives in this country, and to recognize our potential for collective care together. And so as I wrap up this land acknowledgement, I want to invite folks to take 4 deep breaths with me, one for every direction, to get grounded as we begin, because the stuff that we're going to talk about today, the stuff that we're struggling around is really, really heavy. So 4 breaths. All right. We're going to begin now. So today we're going to start with an overview of who our coalition is, the problems that we're working to, that we're facing in Alameda County, and the solutions that we're hoping to bring. After that quick overview, we're going to move to a panel discussion that's really grounded in lived experience and personal story. And after that, we'll invite you all to ask us questions or to celebrate with us and share your reflections and remarks. So with that, I'll ask Zoe to share the screen for us so we can get started. Awesome. And I'll be co-presenting with John. So if we can spotlight him, that would be fabulous. All right. Do you mind going to the first slide, Zoe?
Is that coming through for you, Tash?
Yeah, all the way to the beginning of the slide deck.
Isn't that this?
No. Oh, amazing. Beautiful. Awesome. Thank you so much. Yeah, so again, my name is Tash. I'll be moderating and hosting today. And I'll just share a little bit about myself. I was born and raised here in the Bay, and I bring my lived experience as a queer person who was locked up at 14 for substance use. I've also had multiple family members who've done time for the exact issues that we're talking about today. And so the fight for community mental health and decarceration is very near and dear to my heart. And I'm also excited to celebrate wins. Winning around this issue feel really rare and small and incremental, but we had a massive win for the county. And so we're excited to, both get grounded in the problems and the crises that we're facing, and also to be together in community on the Zoom channel. And so, yeah, this is us. We're the Care First Community Coalition. Next slide. And this is kind of an overview of what we'll be discussing today, a bit about who we are, our solutions, what's ahead, and the support that we need to see our victories through. Next slide. And so, yeah, the Care First Community Coalition, we fight for two things. One, our ultimate number one goal is to reduce the number of folks in Santa Rita jail with behavioral health needs. And to not only do that, but to prevent future criminalization and incarceration by ensuring that we have a continuum of care that's really serving everyone and that folks have the wraparound services that they need. Our second goal is to really move a budget agenda that prioritizes the first goal that I just shared. And we've done that in a few ways. We do that on a policy level by passing a Care First policy that we can hold the county supervisors accountable to, but also really organizing around the budget process, which is a whole different legislative process that can be really wonky, and that we're excited to kind of share our lessons around, because it can be a very opaque and untransparent system. Next slide. And this is really who makes up our coalition. Our work is incredibly holistic, and you have to be holistic in order to work around these issues where oppression is hitting our people in multiple directions simultaneously. And so with that, you can see in this list that we're made up of a rad and diverse constellation of groups like John, who are experts around data analysis, folks like Felton Institute and the Behavioral Health Collaborative, who are coalitions of many of our community-based service providers. We work with faith-based groups who work on housing advocacy and supportive housing. And we work with folks who have lived experiences, people who are family members, and folks who, like us at Restore Oakland, who are invested in community accountability and healing justice. And so looking, I just really want to lift up our member organizations, because we would not be here without this collective of people. And by working collaboratively, we're ensuring that we're behind the people who have lived experience, who hold the most information and the knowledge and what's needed to end our county's reliance on incarceration. Next slide. Right, so as you all may know, Alameda County is in a serious crisis. This is in the news all the time. You see it through the scandals of the sheriff's department. We see it through the ongoing deaths of over 60 people in 8 years inside of the jail. And we see it on our streets, especially in the flatlands, especially in communities of color. So next slide. So we're really looking at this crisis and working to address this crisis in a systemic way, also at the intersection of mental health, housing, and criminalization. And so looking at this chart, on any given night, over 9,700 people experience homelessness in our county. This number grows to approximately 15,000 people over the course of a year. It's a lot of people. In addition to that, about half of the folks who are experiencing homelessness on the streets of Alameda County have a mental health need or diagnosis. Also, half of those people have a history of criminalization. This slide around racial demographics of those who do experience homelessness tells us that Black people experience homelessness at more than 4 times their representation in the general population of the county. And people of color make up more than two out of 3 people who experience homelessness, which means that in order to do this work well, we really have to center our work around racial equity. And it also means that the systems of care that do exist are not culturally relevant and are not serving Black and brown folks in the way that they need to. Next slide. I'll pass this to John.
So good morning, everyone. My name is John Lindsay Poland, and I co-direct the California Healing Justice Program of the American Friends Service Committee, which is part of the Care First Community Coalition. It's really great to be with you here today, and thanks to Restore Oakland for putting this together, and you all for being here. As we look a little bit more at the problems that this coalition is attempting to address, this particular slide seeks to convey the scale of the problem and also the ways that these issues interact with each other. So even though there are 3 circles here, one of representing the people who are experiencing serious and persistent mental illness, another of people who are incarcerated or otherwise system involved, and then others who are homeless. It shows them all the same size. But if you look at the numbers, the number of people, and these are estimates from county agencies that were brought together by the Reimagining Adult Justice initiative. But the number of people with mental illness is definitely the largest number here. And yet it's also true that these things affect each other. If you are homeless for any period of time, you're going to be criminalized. You're much more likely to encounter police and be brought to Santa Rita jail. It's also not good for your mental health to be out houseless. Similarly, if you are incarcerated, it negatively impacts your mental health, and it can upend all these material things in your life that when you get out are much more likely to lead you to be houseless. If you have a mental illness that is not being successfully or adequately responded to with services or treatment, then you are much more likely to not have a stable housing. And you're likely to be criminalized. So all of these things reinforce each other. And that's why we're trying to address this in a systemic manner, because we recognize that there are tens of thousands of people who are being affected by these problems just in Alameda County. If we can go to the next slide. So this is just one representation of part of the county's budget. So the county has a budget that's more than $3.8 billion, but most of that money is earmarked. It's federal or state funds that the county doesn't have any discretionary power over, can't make decisions over. This represents the amount, just under $1 billion, that the county, and specifically the County Board of Supervisors, has some control over. And if you compare the blue section with the gray section here, you'll see how the county's priorities are reflected, in which public protection, which is primarily the sheriff's office, also includes the DA, also includes the probation and the public defender's office, but most of it is for the sheriff's office, is more than twice as much, almost 3 times as much as the county spends of its own funds on healthcare. So that's a priority that we want to shift. And that's what we've been working for. Next slide, please. This shows one of the perverse phenomena in our county, which is that for a number of reasons over the last 15 years, the county jail population has gone down. Even with the state's realignment program, which shifted more, especially longer term folks who have been incarcerated into the counties, the number of people in the jail has gone down. It's less than half what it was in 2008. And yet at the same time, the sheriff's budget, which is more than half of that, approximately half of that, is to run Santa Rita County Jail, keeps going up and up and up. And so even with all of the abuses and systemic problems and corruption within that county agency, the response that the county has given has been to give it more money, with the idea, oh, if we had more deputies in the jail, if we had more programs for those deputies, if they were paid better and so forth, then we will solve the problems in the jail, which has not been the case at all. We can go to the next slide. Tash?
So yeah, we just gave you a really high level sense of scale of what this crisis looks like in our communities, on the streets, of folks who are experiencing homelessness and mental illness. In our jail, our jail also has an incredibly high pretrial rate at, I think, above 94%, the second highest in the state, which means that a lot of folks who are in the jail don't need to be in there. They could be home with their loved ones getting the care that they need, right? As well as what it looks like in our county budget. So a lot of the work, this gives you a sense of how we have to be studying what's going on in the county, what people are experiencing in multiple levels, so that we can address this both from a budgetary side and also through a really human-centered side. And so next, we're going to share a bit about our solutions and our budget run. And our solutions are really about developing a continuum of care that includes a full spectrum, so that people can receive and live stable lives at home alongside their loved ones in their communities. Next slide. So yeah, these are some of our guiding principles that we use to kind of guide our work and how we develop our solutions. We are really grounded in racial equity, making sure that any solution or any policy, any recommendation we bring up is both informed by Black and Brown folks who have lived experience, and also we try to make sure that these solutions are culturally relevant and serve folks and are effective. We do that in the way that we organize, and we do that in the work that we put out. That looks like holistic engagement. That looks like ensuring that we're informed by data and research. We're really trying not to invent the wheel. We really want to learn from what's effective and what exists out there, which is why it's so important that we have folks like Curtis and other service providers who are showing up in our coalition alongside us. We also move with a harm reduction approach. We know we cannot decarcerate the jail overnight, but the solutions, there's no one fixed solution, but the solutions that we bring forward are going to try to reduce harm and avoid law enforcement. We bring a housing first framework, which we don't have that much time to talk about today, but it's, really making sure that people have a roof over their head, that they have a stable place to be, and that they don't have to jump over many, many different hoops in order to prove themselves so that they can get housing down the line. Everyone deserves long-term housing. And so that is the framework that we use. And once you're able to get that housing, right, it's a lot easier to get the care that you need. New programs, new dollars. That is a really big guiding principle for us. This is not just about shuffling the seats on the deck of that Titanic. This is not just about, creating a new program where you have to pull money from one area to fund another new program, which is what we know the county loves to do. This is about being innovative, being creative about where we can source, where we can find new sources of funding to be expanding these programs. And our eighth principle is again rooted in equity, making sure that we expand equitable access as we think about creating this community-based continuum of care. This is a picture, oh, if you go back. And of course, we don't just do this through a advocacy and policy lens. We also have done direct actions. And so a lot of the pictures that you see are either from this coalition or previous iteration of this coalition's actions that we've done in front of the Board of Supervisors. This is a car caravan that we've done. And so a lot of the things that we've done over the years have really led us to this victory in this moment, where we've been able to mount enough pressure to create some change. Next slide. Is this you, John, or is this me?
This is you.
Okay, great. And then what we also know is that community care is cost effective, right? So based on our research, the annual cost to incarcerate someone, so this doesn't even include all of the harm and trauma that incarceration creates, but that incarcerating someone in our county is about $160,000 a year, while offering permanent supportive housing, wraparound services like housing navigation, social work, counseling, any services that that person may need, including perhaps subacute inpatient care, that the sum of that is still less expensive than incarcerating someone at Santa Rita Jail. And these three forms of care are for folks who have serious or persistent mental illness, right? And we know that that is not what that is what some people in Santa Rita Jail have, but that is not what all are, right? So we know that in the long term, this is cost effective. It may take more work. It may be more holistic, but that it is financially a much more sound avenue, as well as being, morally ethical. Next slide. All right, and so in our budget agenda, we really have done a lot of research, and the county has also done a lot of research on this, and sounding the alarm on how urgent and desperate supportive housing is, right? And for folks who are less familiar with housing, this little house in this graphic does a really good job in describing what supportive housing can look like. And so it includes housing that's flexible and affordable, where there's care coordination with health and social services, where there are folks on site. It can be 24/7 in that supportive housing, facility or unit or complex, providing folks with the medicine that they need or whatever counseling care that they may need. It ensures folks have tenant security. It ensures that folks also have access to job employment and job counseling. And supportive housing often uses a really sweet harm reduction approach. And in some cases, folks who are peers are also hired to be able to provide trauma-informed care. And so the county's own Office of Homeless Care and Coordination identified a need that the county needs to more than double its supportive housing units. We currently have 3,200, and based on the research they done, they need 4,200 more, right? And so this is the type of research that really informs the budget agenda that we're going to share with you in a bit. Next slide. Oh, we're going to share with you right now. I'll pass it to John.
So I want to say something about why this coalition focuses a lot of energy on the budget. In May of 2021, the county Board of Supervisors, really as a result of the work of people in this coalition, adopted a policy of care first, jails last. And it sets out values, it sets out some goals. It established a Care First task force, but it did not allocate funds. It did not have a budget mandate. So the task force that was set up by the county, made up of 25 people, many of them from county agencies, some from of community members, is supposed to come up with a plan over a 2-year period. And there's a lot of overlap between members of that task force and members of our coalition. So we have an ongoing back and forth with that task force and our coalition in terms of the direction of what programs are needed, as well as what budget commitments would be needed. The budget the agenda that we came up with is based on a lot of different sources. And there's a lot of numbers here, but I just wanted to note that this agenda is based on county agency reports, like the housing coordination, homelessness coordination numbers that Tash just presented, from providers, and you'll hear from one in a moment, from family members who are trying to access the system, from the Mental Health Advisory Board of the county, which is also investigating many of the same issues and advocating on them. We have meetings with county officials where we learn really important and interesting things. There's litigation against the county by Department of Justice, by RBGG, a private firm, by Disability Rights California. And those things also surface important information about unmet needs, right? Because that's our standard for what we're trying to get the county to do, is to meet the unmet needs. We also submit Public Records Act requests that give us important quantitative and other types of information. So what our agenda includes is, first of all, some things that would add capacity for the county to seek more money, because at the state and federal level, there is a lot of funding for the types of programs that are needed. And sometimes the county just doesn't have the staffing in order to go after that money. There also, as in many counties, there's a staffing shortage, and that requires paying people more in order to attract and especially to retain staff, both of the county employees as well as the organizations, the community-based organizations that contract with the county to provide most of the behavioral health services. Then we know that the care needs to be expanded on a variety of levels throughout the entire trajectory of someone who is at risk of being incarcerated or not receiving the care and services and housing that they need in order to not be homeless, to not be hospitalized, to not be incarcerated. And so the bulk of our agenda is really to expand those services and fill those unmet needs. If we can go to the next slide. So this is what the county did this past June, in response to our agenda. We didn't get 173 million, but we got a commitment by the county to more than 50 million. Now, a lot of that actually was put forward by the county's behavioral health director, Dr. Karen Tribble, a year before, and the county had just not really done anything with it. The supervisors had not. And so we just kept pressing for it. A lot of that is, it's not necessarily preventative. It's not addressing the housing needs, but it does have some subacute care pieces. It has a lot, some expansion of wraparound services. But we also noted that the Department of Justice litigation against the county identified a tenfold increase in the number of wraparound services, the resources for wraparound services. And so we said, okay, at least double it. In addition, from family members, we learned, and from attorneys, we learned that there are some subacute beds that the county has that are not being used, and they should be used for people who have those subacute bed needs. So the county made a commitment to all of these things. Exactly how it's going to be implemented, again, requires additional advocacy and voices from the community in order for the county to actually implement those things. I'll turn it back to Tash for the next slide.
Awesome. So yeah, John shared a bit about, all of the inside, outside organizing that it took us, the back channeling, the research, the studying, the meetings with officials and family members to kind of figure out how to create a data-informed budget agenda that was participatory and incredibly iterative. We've done this for a few years now, and so we've just kind of been building from what we learn year after year. Something that we did in our budget agenda that I believe Alex, our wonderful person in the coalition, shared in the chat is our budget agenda. And in our budget agenda, we identified where the source of funding could come from. If it could come from county reserves, if it could come from the general fund. And this was something that the county soups actually took up, right? A lot of folks are putting out, this is what we want funding for, but are not doing it like some of the work to identify, there's state funding here, there's reserve funding here, there's general funding here. And I think that in our advocacy was something that I think the supervisors really liked. I know that there are some folks from Sacramento organizing in this room. And so we're happy to share with you kind of offline about how we came up with that. But that's something that I think we did new this year and last year that really worked in our favor. We also, leading up to our advocacy, did a county budget 101 training that shared a bit about what we shared today, that goes a little bit more in depth around how to understand the budget, who are the power players, and how to navigate this process, and really, share our learnings around how we've tried to open it up. And we've also turned out dozens of residents, not just in these budget meetings, but outside of them, in all of the realms that county heads or county officials will show up in. And that also looks like participating in public comment. It looks like you can see that we projected these messages on the county building leading up to an action. We've also worked diligently to try to organize the press to talk about this. What we see the press talk about often are kind of the scandals, the deaths that are happening in the jail. But there's a real neglect that's happening in the care systems and in the communities, right? That lead folks to getting arrested and criminalized. And we do a lot of work to connect these dots. Next slide. So what's ahead and what's the support that we need? We're at a really important junction in time where, after years of the Board of Supervisors doing, the business as usual thing of allocating more and more money to Santa Rita Jail, we've gotten the board to commit $50 million. At least there's still some amounts that are still to be determined. So we know that this is a first step in the right direction. We also know that the $173 million budget agenda is what we would hope the county to invest in 1 year, right? But there must be a much longer coordinated effort and commitment from the county to get that 50 million out the door and to fund the rest, right? To fund those long-term solutions like supportive housing that we've talked about. And so in January, we'll be mobilizing because the county administrator, which is the lady who holds all the purse strings, will tell us how she foresees how she would like the county to fund those $50 million. So we really want to make sure we mobilize and show up to make sure that she gets it fully funded and out the door, so that all of those services that you saw in the earlier slide get funded now. A lot of these services that were funded through our budget win are around, mobile crisis. And we're also trying to get the county to move away from orienting its care around crisis, but also in prevention, right? In reentry, and everything along that continuum that people need and that family members and loved ones also need. And so this means that we have to continue to strengthen our data analysis to measure the unmet need that John was talking about. We are continually working to publish op-eds, writing letters to the editor, creating contents, doing trainings like this, and sharing stories to humanize this issue. There's lots of writing in the media around housing and the housing crisis, and there's lots of writing around the egregious conditions behind the jail, but not much that really talks about the care that's really needed in the human experience and stories. So we're really trying to bring that forward. And we're also working to hire a full-time organizer. We really want to build our base. We want to share more of what we've learned around, what it means and what it looks like to be fighting for abolition in a local environment. And so we're also working to grow our capacity. This is, at this point, an almost voluntarily run coalition. And in order to do these things, we need funding and we need resources. And so if you're a funder in the room, we would love to follow up with you about this. And we also want to connect and grow our movement for decarceration locally and statewide. There are groups that are working on Care First. There's a coalition called Care First California that we hope to get involved with. There are state bills and state policies that are coming down the pike that we want to have the capacity to monitor and to inform and to be involved in. And so, yeah, these are some of the ways that we're interested in growing. And yeah, I'll toss it back to John to see if I missed anything.
No, I think it would be great to hear from our panelists. Thanks.
Awesome. So yeah, that concludes the end of this overview. And I just wanted to take a moment to pay special thanks to our coalition members. Some are in the room and some are not here, we've been organizing relentlessly week after week in a pandemic. Thank you for bringing your full selves to the table. Thank you for bringing your stories. And I also want to thank massive kudos to the Restore Oakland team, who are kind of doing all of the Zoom on the back end, making sure that folks are cared for and getting their questions answered. Awesome. All right, so with that, we're going to shift to our panel discussion. If someone can pin Margot and Curtis, that would be fabulous. And I'll just start by reading some introductions. So in our panel, we've got Margot Dashiell, who is a member of the East Bay Supportive Housing Collaborative. She's a retired community college instructor for more than 20 years, has been a family member activist, joining diverse groups of families who face mental illness, and whose advocacy focus on a strong continuum of acute care, subacute care, and supportive housing. For the past 5 years, she has chaired a committee outreaching to African-American families facing mental illness and/or substance abuse. I'd also like to introduce Curtis Penn. His pronouns are he, him, with the Felton Institute. Curtis is the Division Director of Justice Services at Felton Institute, the Family Services Agency. He oversees the Justice Services Reentry and Behavioral Health programs in both Alameda County and San Francisco County. These programs serve an ever-growing population that has been impacted by severe to moderate mental health issues, as well as hyper-incarceration. And I would also like to introduce John, who introduced himself earlier, but I'll do it again. John Lindsay Poland is my work wife and my comrade. He also co-directs the American Friends Service Committee's California's Healing Justice Program. He helped author the Alameda County's Care First Jail Last policy and has led efforts on policy and legislation for police demilitarization in California. John is currently on sabbatical right now, and so we are so blessed and feel really lucky to have him join us today. So a round of applause, hearts, emojis, lots of love to our amazing coalition members. I want to note that Margot does have to hop off at 12 o'clock to make another meeting. So we'll just ask, we'll open this panel up with a question for Margot first. If you have any questions for Margot, please feel free to share it in the chat and we'll make sure she gets back to you. So Margot, welcome. Can you share your story as a family member who supported someone with mental illness? What did your sister need and why is this fight important to you? Margot, you're on mute.
Unmute, but here I am. Yeah, thank you, John and Tash, for all of the overview and the analytic work. I am what I call a tribe member that is of family people who care for someone who's living with serious mental illness. And I want to acknowledge that it's heart-wrenching work. That walk is a long and tortuous walk. And I want to thank the other family member advocates that I see here today. It gives me strength to see you, Allison Monroe and Tony Valia. Thank you for being here. They too are in that tribe of sort of a kind of a upper echelon of family members who do that tireless work of advocating in a system that is vast and complex and really has a very marginal role for family members, despite all of the wisdom we carry. I am here because I represent the Care First Coalition. I'm sorry, I'm in the Care First Coalition and I'm on the Care First Jail Last Task Force. And I'm there because the East Bay Supportive Housing Collaborative asked me to represent it. My organization, this housing collaborative, emphasizes and advocates for supportive housing because we realize that a stable life for so many with serious mental illness is not possible without the appropriate services to make living independently possible. There are so many ill people cycling through the jail and cycling through psych emergency services and being turned away. And they go into the homeless encampments, and at least 40% or more are living with serious mental illness. And I think that's been said. And a huge percentage of these are Black, and none of these seemingly intractable problems can be resolved without the groundswell of public support that this Care First Coalition has already organized. In isolation, our East Bay Supportive Housing Collaborative, like other family groups that I'm in, have met with key political and administrative people, and we've had some victories, but the larger county coalition movement, we've seen a whole range of issues intimately associated with serious mental illness, finally elevated by the coalescence of groups and individuals, all focused on a comprehensive agenda of alternative services for the incarcerated, behavioral health clients, and the push for preventive services. So those facing catastrophic illness will get the services before they get to jail. In their adolescence, a math whiz of a cousin and my talented, kind, bright youngest sister became unrecognizable in their paranoia. And I thought about what strains they may have faced in their particular environments. Had their stresses been because of social stresses at school? Like so many families, I was in the dark about why, or more importantly, the what to do. My sister settled down and eventually got a responsible job, but in her 40s, crisis erupted and the police came out. She threatened my mother, and the police thought that we were looking at substance abuse. We weren't. Maybe this was because we were Black, I don't know. But then the difficult journey began. How do you get people who refuse treatment to get treatment? And that's a huge issue we face in the county and in the country. She was taken to the hospital. At one point, she was taken to John George. She pulled it together. She looked good. They released her with a address of a women's shelter in San Francisco. Of course, she didn't go. It wouldn't have been any help anyway. And that was the last chance we had to try to get her some long-term treatment. I maintain that it's a continuing problem for so many families, probably more so for Black families and families of color. That is the lack of awareness about what you're seeing and what to do about it. And if you learn that, how in the world can you access the services, particularly the crisis care and the housing, which is in such short supply? If we're outside these know-how networks, if we're families without insurance or without insurance that covers mental health care, families like my family, who were fearful of the stigma that would diminish the family status or loved one's life chances, how in the world are you going to get the help? What the psychiatrists tell us is that early diagnosis and treatment is highly consequential. Our family has never been fortunate enough in helping our sister get any kind of help. The time we were able to get her 5150 and she wasn't admitted still rankles. 20 years later, she is still severely paranoid. She will not accept funds our mother left her. She is too delusional to get a routine evaluation required to renew benefits she once had. So she's panhandling up and down the coast right now. She's settled in LA County and she won't talk to us, her family that cares for her and worries about her, homeless on the street in her 60s. She won't spend the night in a motel because she fears electronic equipment is spying on her. And yes, in San Diego, she found her way to jail, not to mental health care. For what? She got on a bus without paying. I surmise that Santa Rita is full of people like my sister, suffering with mental illness, who have done the things that impoverished, homeless, ill people are likely to do. More than 20 years ago, I joined other family members in informal family advocacy with behavioral health. I could help myself and have helped myself and my family members by learning more and meeting with administrators. We could get more family wisdom. That is our hope, more family wisdom into the county behavioral health table. We could get better services that would help more families. We worked to get more family members on committees, knowing that if the family voice was not at the table, the need for families, the needs that families know so intimately, we wanted those needs elevated, but families are still quite marginalized, and that is a problem that I work on. With my African American family group, I think we do a modest job reaching out to the African American family and letting the public know about how to navigate the system and understanding mental illness. We bring in psychiatrists and we talk about the culturally responsive expectations we should have, but it's so modest. And we really need a major public health campaign because families on the front line are key in helping stabilize family members, and that's often overlooked. In terms of African American families, I've known for over 10 years this egregious problem, the disparity in the racial demographics at Santa Rita. The director of behavioral health 10 years ago, Mary Thomas, said, yes, African Americans are overrepresented in the most restrictive services, the locked facilities and the county jail. And she funded a report called the African American Utilization Report. Nothing has changed in those numbers. For my part, I'm continuing to work to advocate for families while we work on the special issue of advancing strong, respectable, respectful, supportive housing models. And in the meantime, I'm pleased to be part of the collective voices which brought our concerns in this coalition, brought our concerns press coverage, and that press coverage may have been a factor in garnering the attention of the grand jury report, which was very strong in indicating the investment that's needed in behavioral health. It brought heightened public awareness about severe problems in the jail, which very likely was responsible for the change in the fate of at least one public office holder. The coalition's agenda merited some attention from the Board of Supervisors. And I think if we can continue the intensive labor of organizing, the coalition has the promise of winning so much more. So, thank you.
Thank you so much, Margot. My heart is out to you and to your sister. And thank you so much for sharing, for being so vulnerable and courageous. Yeah, and just for your consistency in showing up for this and seeing how all of these issues are so intimately connected. Yeah, it's an honor to be organizing alongside you.
Thank you so much for your work.
So with that, I am going to ask you a question, Curtis. It's so great to have you. And so, from your experience as a service provider, what are you seeing on the ground? And what do you think is needed to end the county's reliance on incarcerating people with behavioral health needs?
Thank you so much for giving me this opportunity. Before I, discuss probably what's needed to end the county's reliance on incarceration, I'll speak to, why that's important first and foremost based on the data, and then based on my experience as a service provider, I think I would be remiss not to kind of give a brief description of how I arrived here, right, in the space where I'm at now. In 2013, I had paroled from San Quentin after spending 14 years, 6 months for secondary commercial burglary under the California Three Strikes Law. Upon my release, I went to a transitional housing in Alameda County, where I was soon after assigned the position of a residential counselor, where I was given the opportunity to work with individuals with dual diagnoses, in the housing complex. During that time, I went to school and earned my undergraduate degree in sociology and my master's in public administration. I also worked as a reentry consultant with Roots of Success, where we provide environmental literacy and job training. And I also worked at San Francisco State University Associated Students, the program director, where I was involved with facilitating the matriculation of formerly incarcerated students into the CSU system. I got hired with Felton in 2018, and as you mentioned, I oversee a number of programs that work with reentry and behavioral health population. As I had mentioned earlier, with respect to why we need to end the county's reliance on incarcerated people with behavioral health, some of the things that are salient in this area is the fact that folks with mental health issues are often overlooked in the jail population, which leads to higher rates of recidivism. Clients that seek mental health services within the jail are often stigmatized and can be bullied or targeted by fellow inmates. Also, individuals with mental health needs upon release from jail have difficulty finding housing, have difficulty finding employment, and oftentimes do not have adequate access to medical condition or medical attention. And then suicide is the highest rate of death within the jails. Right? I think it's somewhere around 12% for every 100,000. However, California surpasses that rate by about 20.4% of every 100,000 inmates die from suicide. And so based on those numbers, if you factor that in, there is a need to end the county's reliance on incarceration. With respect to what we need to do to end it, to have discussions like this, panels educating folks on the adverse social impact that is the result of incarcerating people with mental health services. I think oftentimes they're siloed. Folks do not see the connection between people who are incarcerated with mental health conditions and these individuals that are now getting released into society, right? They don't see the connection. The other thing that needs to be done is we need to be vigilant and champion legislation that diverts the incarceration of people with mental health issues into the jail. I think that's important. I just mentioned the mandatory sentencing law. And, I was released per Proposition 36 that was passed in 2012 or so. So we need to be really vigilant about passing legislation that diverts people going into the jails with mental health issues. The other, which is also important, is increasing the funding for community-based organizations, increasing the funding for FSPs that work exclusively with the mental health population, both prior to entering the jail and post-release. I think that's extremely important. When you look at these things in its totality, right, and you think about, I know Santa Rita, they are kind of on the high end in terms of the apex with respect to county jails and the lack of mental health services that they're able to provide. Someone had mentioned the Prison Realignment Act, AB 109, that legislation that passed in 2011, and it was interesting to see that even though the population had decreased, the funding had continued to go up, but the funding obviously was not being put or tailored or geared towards providing mental health services within the jail. Right? I think as John had just alluded to, the funding was going elsewhere, so the funding was not augmenting the mental health services within the jail. However, even though the population, say, may have gone down, whether or not the population of folks with mental health needs gone down is something that we perhaps could look at, a little further. And so that is some things that needs to be addressed, looking at the data. The second question, I think you talked about, was building out county's continuum of care. Did you ask that question as well, or was it just the first? Okay. What needs to be done is we need to offer a full array of services, right? And these services involve, obviously, mental health treatment, SUDS treatment, barrier removal, increased life skills, employment, and education, and also having kind of an upstream prevention around addressing folks who are dealing with suicidal ideation. I know with the programs that I oversee and manage, in addition to that, you need to be client-centered and culturally competent, right? And so our staffing model is one in which we hire people from the community, people who have lived experience, such as myself, and are able to understand some of the challenges and obstacles that the population faces. I think that's extremely important. And that leads to the other issue in terms of how to build out continuum of care is you need to be focused on equity, diversion, and inclusion, right? Bringing in people who, have a kind of a visceral connection or understanding to the population. In addition to being just as impacted, I have family members who have mental health issues, my mom being one, and my sister currently going through mental health issues, and my partner, who was formerly incarcerated and also experienced mental health issues. However, she's doing well, gainfully employed and going to school, but that's because of the support system that she has, which is extremely important. And then to build up the continuum of care is also having evidence-based practices and community-defined practices. And sometimes that term is used very loosely. You say evidence-based practices. And in this case, because of the population that we primarily serve are Black people, Indigenous people, and people of color, it's important that the services that we provide are tailored to that population, right? And oftentimes, in addition to the individual mental health services or self-help services in general, there's a component, there's a family component that needs to be addressed, right? And there's a community component that needs to be addressed with respect to providing mental health services. It's extremely holistic, and so we have to be aware of the fact of, when we're providing evidence-based practices, it has to comport with the population that we serve. It has to be agreeable to the population that we're serving, and what may work in one particular community does not necessarily mean it's going to work in another community. And so these are some of the things that I consistently advocate for in the role that I have, right? With respect to bringing in folks with lived experience, bringing in peers. I know with the change in some of the ways in which we're going to provide mental health services, particularly around CalAIM, a lot now will be focused not necessarily on the diagnosis, but on the problem list, right? What are some of the issues that we can address? And that leads to kind of the social and psychological determinants that are often the driver or the impetus behind these behavioral health issues. When I share with my colleagues, particularly my clinical colleagues, I tell them folks who are from underserved communities, Black and brown communities, having a high level of anxiety is a natural feeling, but we do know that that's part of the DSM-5, right? You can be labeled as mild to moderate. I think there's some racial components that are infused in some of these models, right, that are often overlooked. And so sometimes I think we have to get away or get away from that labeling theory to where when you have or understanding the symptomology and diagnoses oftentimes do not add up. They're not aligned, right? And so that's important with respect to addressing the continuum of care. The other issue is, we at Felton are extremely mindful. That term, the warm handoff thing, is something that is used quite frequently. But what we do is we serve the individual, the client, really from the time that they are open to us and to the time in which they're ready to be on their own, right? We have a myriad of services that we're able to provide, and that's how we have that step up, step down program where we have the mild to moderate, we have the SMI population, and so sometimes those things are not fluid, right? And so we're able to provide mental health services to the individuals based on their situation, right? That can change. I think it's also, as I mentioned, it will have to be holistic approach, being able to provide some support for the family, but making sure that they feel inclusive into the process. Right? Oftentimes we will take a survey and say, hey, what from a 1 to scale 1 to 5, or what would you rate the services? What can we do better? That's also a way in which we can build out the county's continuum of care. I had spoke earlier about, my experience, in the state correctional facility, but I will add that San Quentin serves about 50% of the population comes from Santa Rosa Jail, right? And during my time, this was years ago, California Medical Facility, which was Vacaville at the time, was a primary intake correctional facility for Alameda County prior to San Quentin. And just I have to just share this with everyone. I had experienced, folks incarcerated, just put in cages and given medication, right? It was, Thorazine and there's other types of medication where they were isolated, they could not communicate. And so what I had witnessed firsthand is that folks that could not adhere to the institutional norms will often transition into behavioral health modification units, right? Or administrative segregation units, where their mental health issues were compounded. They were exacerbated, right? And then in the event they were released back into society, and if oftentimes they could not adhere to societal norms, and that's when the criminalization comes into play, and they were incarcerated, right? And so it was cyclical. It was a cycle. Right? You're in the community. You're not adhering to societal norms. You're placed in jail, incarcerated, and then you're incarcerated. You can't adhere to institutional norms. You can't follow the rules in the behavioral health modification. And so there was a never-ending cycle that was taking place. And so what we try to do is address those underlying issues that may not be at the forefront. It may not be in that face sheet, right? And that MHS 140 that we call the behavioral health face sheet. And we look at those types of things. So with that, I'll end. So I see that we need time for questions. So thank you so much.
Thank you so much, Curtis. Again, I have learned so much about you, even as someone who organizes in this coalition with you in those brief 10 minutes that you shared. And so thank you so much for sharing your story and for doing what you do every day, day in and day out, for folks who have the most gaping wounds. And then with that, last but not least, I'm gonna ask John a question. As an advocate, what are the lessons and reflections you've learned from our campaign? And what do you see is needed to see our win through?
Well, first, I want to just add my voice to how much I appreciate hearing Curtis and Margot and all the members of the coalition. I think that is actually one of the lessons from being in this coalition, is that there is so much wisdom, there's so much insight and experience that has to inform the advocacy that this coalition does. and it's right here. So I'm just really grateful for it. A couple points I just wanted to add. I think one of the things that we've seen is that litigation against the county for the terrible mental health conditions in the jail and the subsequent court settlement have really focused on mental health needs in the jail within whatever supposedly can happen to support people's mental health in the jail. And our coalition is really looking upstream and at prevention. So that really includes prevention for people being incarcerated, but also the types of sustainable, the kinds of practices that Curtis was just talking about that make mental health care effective in each of the communities where it's needed and sustainable in all of our communities. I also want to note that when you're working on a budget proposal, as the county does, as we've done, the county has actually done a pretty good job at quantifying the need for housing. And it is easier to count people who are not well housed. It's a physical thing. The types of needs for behavioral health that we've been talking about are a lot of times harder to quantify, even for one individual, much less, you can't just go out and count people in the way that you can count people who are unhoused. And so that it requires more of that input from families and providers and advocates that we're trying to do as a coalition. The one other thing I want to say is that it's not often talked about as much, but substance use disorders are a mental illness. And even though the county says that they don't arrest people for substance use, for drug possession, or that drug offenses are no longer a real thing in the county, I would say a few things. One is the type of thing that Curtis was talking about, where someone who, for their mental health is deteriorated, or they're using a substance and it leads to a behavior that gets them arrested. Second thing is, you have a lot of people who, as Margot said, don't have a mental illness, but refuse treatment. And they may refuse treatment because they don't recognize that they have an illness, but they may refuse treatment because the drugs that they're given, or the type of institutionalization that could result, they don't want. And so many people are, so-called self-medicating, which has its own issues, right? So someone who turns to speed as a way of dealing with their own condition, then that often compounds things and then leads to other types of behaviors, right, that criminalize and or are just not good for people's well-being. And then the other thing is that a lot of folks are in Santa Rita jail for DUIs. They're driving under the influence, and that it's related to a substance use disorder. Often, not always. So I think that's another piece where the county needs to step up. And we have a county race for the DA that may have some impact on that, in terms of how people are charged, whether they're charged, and what other types of options are available to people, as well as all the upstream stuff that is so important for preventing people getting into the situation where they are behaving in ways that are harmful to themselves or to others, or that lead them to encounter the carceral system. So there's lots to do, of course, and I think we have we need to grow it. We need to grow this coalition for sure. It needs to be geographically more diverse, and there's ongoing work to do with all of the different communities represented in the coalition to ensure that the county really responds in in material ways as well as rhetorically to place care first.
Thank you so much, John. A round of applause to Margot, to Curtis and John, for sharing your reflections, your stories, and for, yeah, really just sharing from the heart. Thank you so much. A few highlights that I heard is that, you know, there is a real need for our vigilance and for a vigilance that this coalition exhibits in organizing in a long-term way, a way that's rooted in centering not just individuals in crisis, but to recognize their wholeness, what they've learned, what they bring, and the importance of their loved ones who are supporting them in a long-term way. Their loved ones who are navigating an incredibly complex and inaccessible system. I also heard that it's, you know, it's inefficient to just tinker around the edges of a deadly system by just trying to make the jail less deadly. There's plenty of people doing that. But what we're trying to do is really shrink the system that's really punitive and extractive, and to shift resources, public resources, away from that system and towards a system that prioritizes care and that prioritizes meeting people's needs so that folks have the tools, the stability, and the spaciousness to heal and be with themselves in a solid, healthy, beautiful way. And we do that by following the money, by organizing for material change. And in doing so, we're able to help move the energy and intention of the county decision makers, right? In a way, in a really caring and holistic way. And so I kind of heard that from all of the panelists and want to invite all of the participants who are in the Zoom room with us to throw up hearts, give them a round of applause, share them love. Sharing our stories is not always easy, and takes a lot of work. So thank you so much. We have time for maybe a few questions from folks in the audience. You're welcome to unmute yourself, raise your hand. We can call on you and you can ask your question live. You're also welcome to add them in the chat. I know that a number of people have asked questions already. So do folks have any questions for us?
See one from Tony.
Thanks. Couple questions. In the 21-22 budget, I recall when the supervisors didn't want to approve the whole 50 million, they told behavioral health to find 8 million from other sources and use it as stage one of the 50 million. Do we know if anything happened on that?
The behavioral health did find that money, dedicate that money. I think they even added another million or close to $1 million towards the proposed program that Dr. Tribble had put out. And so it wasn't all, I don't think it had all been spent by the end of June, but it was at least allocated. Of course, that came from another part of the behavioral health budget. So, you know, we were concerned about that. And then this time in June of 2022, the supervisors approved an action for behavioral health and the county administrator to come back to the board with a plan for where to find the rest of the 51 million that had been proposed. That has not yet occurred, but it was a political commitment to fund and from county dollars, or at least from available dollars, the rest of the proposed amount from behavioral health.
Thanks. And it's another quick question with CalAIM, and I may be confusing this with the original Care First Jail Last from Southern California, but I remember there were lots of things that were going to change, like Medi-Cal would be available for people within jail while they were in jail, whereas before it wasn't, and for whole person care, including forensic and, you know, housing and all that. Has any of that been rolled out yet with CalAIM? Do you know?
I might turn to our interfaith Interfaith Committee for Justice in Our Jails folks here. I see Myrna, and I think others are here who have tracked that and are members of the coalition and who have tracked that more closely. My memory is that it's coming, but not yet happened.
That's right. That's my understanding as well.
Okay.
And just to add,
Yeah, not in 23. I think maybe it's been pushed to 2024.
Oh, brother. Okay, thanks.
Unknown caller.
Allison has her hand raised as well.
hello,
Hey, thank you. I'm sorry I put so much in the chat. I have something going on with my family member right now that's driving me nuts. And sometimes it comes out in the form of typing incessantly. The only question I have that maybe is urgent at all is how solid is the commitment to the 50 million, and how solid is the commitment to the the subacute residential beds inside that, which John estimated at 2 million. I know they're talking about buying back some beds at Villa, but I don't know that anybody's actually said they're going to do that. Also, I don't know that we've actually got the 50 million yet. Some of it is going to come from MHSA eventually. The county's been going to MHSA for money for a peer respite and a crisis residential and different programs. But I don't know that they actually said they would fund the 50 million. I wish I understood the budget better. So what's happening with the 50 million and what's happening with the 2 million to buy back beds at Villa, if you can tell?
So again, this is an instruction from the Board of Supervisors, which is a decision by the Board of Supervisors. It is not the same as a budget allocation, but it is the political decision behind the budget allocation. So the 50 million for a variety of services, not including the additional beds in Villa Fairmont for subacute care, has to come from somewhere. And so that's why at the time of the budget deliberations, the Board of Supervisors did not know exactly what the source of all those funds would be. Is likely not to be one single source. It's probably going to be multiple sources, which is why they instructed the county administrator and behavioral health to come back with a plan for how that plan, so the expense side of it is already defined. The income or revenue side of it is not yet defined. And that's what the administrator, county administrator, and ACBH are instructed to come back with. In terms of the Villa Fairmont beds, what Dr. Tribble, the director of behavioral health, has told us is that it requires a recontracting. So first, the funds have to be identified as well. And there needs to be a shift or a change in the contract with the a CBO that runs Villa Fairmont. This is what she told us, Allison.
Yeah. Telecare has been, sorry.
And so that again is an instruction from the Board of Supervisors. The instructions from the Board of Supervisors can be reversed, right? But that is the instruction from the Board of Supervisors. So again, my interpretation is that the political decision has been made, and exactly how the funds will move, something that must be reported back to the board.
Yeah, Telecare has been saying for years that we could have those beds back. I don't know if that's useful, but they have been saying that for years. But it's great that anybody's committed even trying to get them back.
And as Tash has just said in the chat, there will be a funding update from the county administrator in January, and we will be mobilizing around that, because the questions that both Tony and Allison have raised, the county is not to be trusted, right? I'm sure as family members, you've gone through many cycles of these things. And so that is why we will be mobilizing in order to ensure that the county follows through on the commitment that was made by the supervisors.
Hey, thank you.
Awesome. We are at time. Thank you so much for sharing these questions, for joining us, learning alongside us. And yeah, and I think diving deep into this. We're excited we've recorded this session, so we will be sharing the recording as well as our slides out with everyone. And yeah, I'm excited to connect with folks who are just learning about this now. Please feel free to reach out to us via email. You'll get an email from all us today, from all of us in the next few days. Thank you so much and have a great afternoon.